my name is Diana Cardona. I am an ICU resource nurse at the University of Washington Medical Center. I also work at Evergreen Healthcare in the critical care unit. I've been there a year and a half. Prior to working there, I was an oncology ICU nurse at the University of Utah for about 3 years. That's kind of where I started off right off of nursing school. I'm from a little small town in Oregon called Bend. And prior to all this nursing, I stepped into the medical field as a medical interpreter / social worker at a pediatric clinic. Kind of saw what that was like, and I really enjoyed it. Had a couple of nurses and providers who kind of kept pushing me along the way, told me that I should consider medical school, and I thought about it and figured that nursing was kind of the best option for me. And then I kind of went that route, and that's where it's landed me, and I love it. My day-to-day kind of depends on where I'm working. So since I'm part of the resource team, I do a variety of different roles. I do dialysis, I can do stat nursing, peripheral placements with PICS as well. So my day kind of varies, but usually I come in, I do go into the safety briefing, and we sign attestation forms with this whole COVID thing, and change out our masks, get report from nurses, and then we will look at the chart, kind of settle out our day in terms of what the plan will be based on the care for the patient, and it just kind of varies. And then with dialysis, we just are crunching a bunch of numbers and figuring out what's the best way to go about their treatment plan. My eventual goal is to go back to school and get a degree in family nurse practitioning. I would love to get my DNP. I'm just trying to figure out my financial situation, which is kind of why I'm working another job, trying to get that kind of out of the way before I start the DNP route. It would be great if I could start kind of fresh. I chose the career in healthcare because there's a lot of things that drew me to it. I am such a giver, and I feel like I'm a very empathetic person, and I love to help others, and I know that sounds super cliche, but that's kind of what drew me towards it. And I love collaborating with other minds and kind of critically thinking and challenging ourselves, and different aspects of science, and also just working like with the whole picture and holistically. So I love the details and I love the whole picture, and it's really nice to hear what other people have to say, as well as like being part of someone's most crucial moment. I mean, it's an honor to be able to help someone when they are going through the uttermost difficult time in their lives. And so I'm thankful that people can trust me to do my job and to be able to help them. So it means a lot to me to be a nurse. I take my job super serious. I think patients deserve the best, and I thrive to do my best. Because they look at us and they trust us, and I think that means a lot for our profession, and I think that we play a vital role in healthcare. We wear many different hats, and especially with COVID, I feel like now our names are kind of more out there, word of the mouth, and so I'm always trying to study and catch up and read the latest news and articles so that I can provide my patients with the best care that they deserve. I think that the impact that I would love to leave on the healthcare system or my community is a positive one, obviously, but I would love to kind of break that healthcare disparity cycle. I'd love to work with other people and collaborate and figure out a way where we can provide care and not so much look at people for their disparity that they're bringing. You know, like, we should be able to treat you without looking at your socioeconomic status or your financial situation or the color of your skin. And I'm on the resource practice council, the unit practice council, sorry, and we work at ways at kind of dissipating that. And so I hope that we can break that cycle so that we don't have to compromise our patients' care and their health. So in the next 5 to 10, 15 years, I would love to have people remember what I did. I go to high schools and speak about my career because I'd like to see a lot more minorities in the healthcare setting. I'd also like to have patients remember the kind of care that I gave them and have them feel like they truly were the focus of my day, you know. And the person that inspires me the most is my mom. She's the one that kind of helped me throughout this. I was the first person to graduate high school, and I hope I can repay that to her one day.